has number. So what we can see on the fundoscopy is the main landmark of the fundoscopic finding of ocular toxoplasmosis is the scar formation. Okay, so you can see this black scar formation on the fundoscopy. Just remember this, that all the other findings, the chorioretinitis, okay, retinochondritis, and vitreous inflammation, it is usually very difficult to appreciate on the fundoscopy. Okay, so just remember that there will be a scar formation in ocular toxoplasmosis. Okay, so what are you going to say about in the diagnosis? You are going to say, tell the patient that you did very rightfully about asking about the idea. Then you did ask about my concerns, and that is a wonderful IPS. I must say that you had a very good IPS. Okay, so just try to keep up with it. And so regarding the diagnosis, what are you going to say? That it is the infection by a bug. Okay, try to use the word bug because it's commonly used in the language. So try to use this word in any kind of infection by any bacteria, virus, parasite. Try to use the word bug. Okay, so it is called by the Toxoplasma gondii. You should mention, you should be able to mention the risk factors that she had for this disease in this scenario. So you need to mention that since you are having cats, it is transmitted through their feces too. Okay, and what caused you, because there are a lot of people who are having cats, and not everyone gets toxoplasmosis. So what made her go through this condition is her immunity level. Okay, since you are having decreased immunity for some time because of the disease and the use of steroids, and you are having these cats at home and you have been dealing with their feces. So these are the risk factors in your case that have caused you this disease. So try to, Lab 2 is all about being unique. Okay, everyone knows what they are going to ask. Everyone knows the structure. Everyone knows how to ask questions. Okay, and almost everyone reaches the diagnosis as well. But these are the little different things that you say in your consultation. Okay, for example, not everyone remembers to mention the risk factors that were present in this case. Okay, because we are usually not practiced to telling the risk factors that are involved in these situations. So always try to mention, act differently and mention something differently so that the examiner and the patient do remember that, yes, that person did something different. Okay, because there will be 36 candidates and they will be doing the same scenarios. So they really want something unique. Okay, so how to manage it? Okay, so for the for our scenarios, we do remember a pattern for our history take. So we usually take good history in most of the cases, because we have been practicing these cases again and again, the history pattern again and again, and we put so much effort in history taking that at the end, when we reach our management, either the time is very short that is left, or we have made use of maximum of our energy in the history take. So try to conserve your energy for the management as well. Okay, because it carries the same number of marks as the history taking. Try to manage your time in the history taking as well. Okay, they usually do not try to consume your time in unnecessary details. For example, as Dr. Vincent asked me about my lifestyle, like smoking, drinking, and the drug history. So if it is not very important in the scenario, they usually do not try to waste your time on these questions. So they just clearly say no. But sometimes they do try to make things difficult for you, and they would say, yeah, I do smoke and I think, and you will be thinking about other things as well. So sometimes this happens, but usually they try to save your time for the management part as well, because they are also interested to know if you know how to manage this patient or not. So regarding the management, you need to mention bloods in all the cases, okay, that you will be doing all the routine blood tests. Then there comes the referral. Okay, so you will be referring her to the infectious disease specialist. They will be doing some specific tests. We call them blood serology. They will be doing antibodies level, or they may do some PCR level as well. Sometimes if there are symptoms of any brain involvement, which won't be very important in your case, but you can mention that they might do an MRI scan as well to see if this parasite hasn't reached your brain and it is not causing any problem there. So what you can see on the MRI of brain is ring enhancing lesions. Okay, they are pathognomic for the toxoplasmosis. So if a patient is really young and he doesn't have any history of any long-running illness, or the immunity level is fine, then you don't need to really treat this condition. You just mention the preventive measures on how to take the preventive measures, and just refer them to the infectious disease specialist, and they will be following them up, and the ophthalmologist will be following them up, and they will be looking into it if their symptoms are improving or not, because treatment is usually not needed for the immunocompetent patients. However, in this case, the patient is immunocompromised. She is aged patient, so we need to treat her. And what are the drugs that we need to treat her on? Is sulfadiazine and pyrimethamine. These are used for the immunocompromised patients. And usually this scenario comes with the older patient and the immunocompromised status. So definitely you would need to treat her. Okay, so then with pyrimethamine, we need to give folic acid as well. Okay, because it is a folic acid antagonist, so we need to put them on folic acid as well. Then comes the preventive measures. So regarding the referral to ophthalmologist, it is really not needed to be done right now, because with the treatment, her vision will improve. Okay, so the main concern would be to treat the patient and see if there is any improvement in the vision. Okay, you have already referred her to the infectious disease specialist, and she will be following her up with the test results and her condition. So usually mention of ophthalmologist is not really important here, because it's an infectious disease, and the symptoms are due to the infection of the parasite. And once you are treating this parasite, the vision will improve. She will raise this concern that will I get my vision back? The vision that is disturbed, will I get it back? So you need to mention it. Yeah, that yes, with the treatment, usually the vision gets back to normal. Okay, so regarding the preventive measures, what you need to mention is that if she is having cats, she should be wearing gloves and take good care of dealing with when she's dealing with their feces. Do not try to litter them in the soil of her house, and try to litter them properly so that they do not contaminate her or anyone else. And since it's been transmitted because of the cat, so that means the cat have the bug. So she needs to take her to the veterinary doctor as well. She need to take the cats to the vet. Okay, just try to mention it as well. Then wash fruits and vegetables, all the routine preventive measures that try to maintain hygiene, try to wash your hands again and again, try to wash everything you eat, fruits, vegetables, okay? And since it's also transmitted with the infected uncooked meat, okay? So if you remember about the life cycle of this, which is not really important with us, but just to know that how the uncooked meat gets infected is because this parasite, it gets transmitted by the feces to the grass, and when that grass is consumed by the cattle or a cow or a goat, anything, and then this parasite can go into that into the cow or the goat, and when we consume the uncooked or undercooked meat of such animal, then we usually get infected as well. So mention about the proper cooking of the meat as well. And do wash all the utensils dealing with the uncooked meat. Try to wash them properly and maintain all the hygienic measures. Okay, so she will be raising concerns between the consultation as well about the vision. So just answer it back. And at the end of the consultation, try to arrange a follow-up as well with her. Okay, just to see that everything is going fine, and offer reading material, that is the leaflets of the disease, so that if you are running short of time, okay, and if you are not able to complete everything, because sometimes we are really short of time, and if we have mentioned about the antibiotics or the medicines that we are going to give, just try to mention that I will be giving you some reading material on the preventive measures of how to getting reinfected with this disease and how to stop spreading of this disease. So that even if you are not able to mention all the preventive measures, the examiner would know that you were trying to complete it, but you couldn't because of the time. So the leaflets, they do save you in such situations. So always mention about the leaflets, about the reading material, that I will be giving you the reading material so that you have all the knowledge on this condition that you would be needing in future. Okay, and then regarding the safety netting as well, do mention about if you are having any worsening of symptoms, if you are having that your vision is getting more blurry, or if you are developing any kind of pain in your eye or anywhere in the body, or if you are developing any fever, then you need to come to us immediately or call 999. Okay, so that was all about this toxoplasmosis scenario. I hope I have explained everything really well regarding this scenario. So if anyone has any other question, you can type in the chat box so that I will be able to answer you. Anyone, any questions?
So, hello, thank you very much for the correction. Sorry, I'm just like, I want a clarity on something. You mentioned that not everyone gets treated, and except people that are immunocompromised. I want to be sure I get that part clearly.
Yes, that's true. It's even written in the NICE guidelines that the young and immunocompetent patients, they usually do not require treatment. Because you see, the NHS is really concerned about the prescribing of antibiotics. Okay, they usually are very much particular about which conditions we are prescribing antibiotics. Like usually in our home countries, we do tend to prescribe antibiotics sometimes unnecessarily, but that is not the case in the NHS. So it is clearly written in the guidelines as well that if the patient is young and he is immunocompetent, then they won't be requiring any treatment. Okay, just regular follow-up, doing all the routine investigations and a specific serology test to confirm the diagnosis, and regular follow-up will definitely do good. Also mention about all the preventive measures and taking the cats to the vet, but no drugs will be given to the patient. Am I clear?
Yeah, thank you very much. I'm clear now. Thank you very much. Yeah.
No worries. Thank you so much, Dr. Vincent, for performing. So, Dr. Kuratulan, are you here? Because Dr. If he would need the feedback on his case.
Yes, I'm here. So I can share my screen and then we can continue with the feedback.
Yes, sure.
Thank you so much, everyone, for your patience. Yes. Okay. So I'm having a little bit trouble with my screen as seems a little bit stuck. Mouse is a little bit slow. So please bear with me. Okay. All right. So let's talk about Dr. Ifi's performance. Are you there, Dr. Ifi?
Yes, I'm here.
All right. So very well done. I'm really happy with the way you carried out your performance. It's not at all easy to perform in front of so many people. There are few things I want to add. All right. So let's start from the beginning, from the data gathering part. So when you started the station, when you were talking to me about, you were greeting me and you were talking to me like what brought me here and all these things. It took about 1 minute and 20 seconds. I would really appreciate if you don't spend more than 40 seconds here, because you have a lot of things to cover in the station and you never know how how many questions I will be having after that, right? So
Okay.
in the beginning, like from the beginning as well, try to be straight to the point. If I am coming with some concerns and you are finding it hard to start the station, then it's always fine to say how can I help you. And if you know that there are some concerns mentioned in the task, then you did the right thing later on, that you told me that I think you want to know about immunization schedule, or your child is going to have some immunization and you have some concerns about it. But I would say try to come to the point as early as you can, right?
Okay.
Don't spend 1 minute on all these things.
Okay.
Every second is important in your exam.
Okay.
All right. So after that, your data gathering was really good. Like, you asked me about relevant question. You asked me about general health of the child, any rash, how it's the feeding, how if there is any like concerns regarding his who we everything is okay. But there were few questions you repeated, like you asked me about health 2 times. So
Okay.
if you are repeating some question, you know that in the qualitative feedback you will be getting a tick in the listening part. Okay. So
Yes.
it's not something that will make you fail the station, but obviously it is something that is wasting time, first of all, and secondly, it might not give good impression to the patient. It means that you are not listening actively.
Okay.
Thirdly, about eating, you asked me twice. So these were the questions I found that you repeated. Furthermore, your rest of the history was fine. I don't think you asked any extra questions. You asked me about development, because in peds we need to, because this child is just 1 month old, and in UK first immunization is from 8 weeks old. And also in this station, this chart will be inside. So at any point, if you have any concerns, like if you forget about any vaccination, you can always get back to the chart. You can say that, oh, we have this vaccination schedule with me. You can have a look at it as well, and then you can go through the vaccines. Data gathering was fine. Then comes the counseling station, because this is supposed to be a counseling station, and counseling stations needs to be very uh, you know well structured, so that you can cover most of the things. And also, let me just quickly have a look if we have covered all these things. So yeah, data gathering was fine. I'm happy with it. But when it comes to counseling, always, I think when somebody's want to know something, always ask about background knowledge. What I already know about vaccine, right?
Okay.
Because it will give you an insight what is my understanding, what I know about vaccine. Although when I was asking you about things, I told you that, oh, these are the dead bugs and blah blah blah, right? But it's always
Yes.
best to ask me about my understanding, so that you can start from there, from that.
Okay.
Okay, so you can ask me, what do you know about vaccine? Have you seen anybody getting vaccine? And then you can tell me that these are weakened bugs that we normally give to boost the immune system. It will increase the immunity in the body. The question was, why my child needs vaccine if my child is healthy? First of all, my child needs vaccine because it will prevent my child from deadly infection. And secondly, these vaccines, they are spreading the diseases in community, right?
Yes.
And so these are the two things you should be focusing. You asked me, you told me about this community thing later on at the end, right? When I said, I'm still not convinced why my child needs vaccine, right? So
Yes.
these are the 2 points, main points that you should be telling me. And secondly, if I'm saying, like my child is fine at the moment, so why he still needs vaccine? He is fine at the moment, but when we give him vaccine, it will boost his immune system. So at later in his life, if he gets these infection, these will not be deadly, because we do know that although we are vaccinating children for measles, we are vaccinating them for chicken pox, but still at some point they might get these infection, although they are getting vaccinated. But we know that the intensity of disease is not to that extent that will be life threatening, right?
Okay.
So you can use this point as well if she is not getting convinced. So these vaccines are boosting the immune system. They are providing good antibodies in your child immune system. They will produce good antibodies. So later in the life, first of all, there is very less chance that your child will get infection. And if he gets infection at all, then it will not be life threatening. Okay.
Okay. Okay.
And
Okay.
summarize. Things
Okay.
are better understood when they are in a summary form. You were telling me
Okay.
that there are different kinds of vaccine, although this session is about 8-week immunization schedule, right? So when
Yeah.
we are giving when we are doing any procedure, when we are giving any jabs, we are always doing an informed consent before that, right?
Yes.
So it is a part of informed consent that we are telling them what this vaccine is going to include, right?
Yes.
So you can tell the names of the vaccine. You can summarize them the way I have written on the screen. Like there are 3 types of vaccine if you look at the picture. So rotavirus is the oral one. And then there is a combination of 6 vaccine which is given as one, which will be diphtheria, pertussis, and tetanus, Hep B, Haemophilus influenza, polio, and then another one which will protect the child from meningitis. So you can summarize it as one vaccine is oral, and then there are 2 jabs. One is a combination and the other one is a single. And these are preventing some deadly infections.
Okay.
So this is a part of informed consent. So after that, when I asked you about the safety, you told me you told me rightly that the trials have been done and they're really safe. And you can also tell that millions take them every year. These are approved by WHO. There might be little bit complications like fever, pain at the site of vaccine. Sometimes there can be little bit inflammation over there, but with time it gets resolved, and there are no serious side effects about the vaccine.
Okay.
Some people are allergic to some part of some contents of the vaccine, so they can have some kind of rash, allergies, but normally it's safe. And obviously, if something happens, then you can always ring 999 or you can speak to your healthcare provider.
Okay.
Okay. So.
Okay.
Okay. So even after that, I really appreciate that after the ending, when I said, I'm still not convinced, I will think about it. So you booked another appointment. That was really good. You can always ask for a follow-up appointment. And if you are unable to, because this is a counseling station, and counseling stations, there are different kinds of counseling stations. Sometimes people are refusing some things. And then when you are communicating with them by the end of the station, if you think they're still not convinced, then what you should do, you can always escalate, right?
Yes. Yes.
So if you are not able to convince the patient, you can always get your senior to speak to the patient, or you can give them some information leaflets, and then you can ask them to come at some other point, or you can ask them to for a telephone consultation, so that you can discuss about these vaccines in a more detail.
Okay. Okay.
And furthermore, although this is an immunization station and a child is not there, But
Mm.
you can mention at the end when you are talking about follow-up appointment, ideally you would like to have a look at the child as well to make sure he's doing well,
Okay.
doing his observations. No need to do bloods, but just to have a look at the child before the jab, obviously. Because if there is any kind of fever, any kind of infection, then we can withhold the vaccine.
Okay. Okay.
And okay, so another thing, another story. I was talking to you, I was asking you these questions, but sometimes in the exam, you will find somebody who is not involved in the station that much. They are not asking you questions, they are not asking you about all these things. But your task is, if you read your task, then your task is address my concerns. And also because patient is going to have these vaccine in 2 week time, then in a way you are telling that this information as a part of informed consent, what you are going to do, what complications they can be expecting, and all these things. So if your patient is not talking, then how will you make her talk? Anything in your mind?
Well, there are a number of ways to approach it. I think one of the ways is to do open-ended I guess questions. Another way is to do what's called close-ended questions. Then you can also engage the patients by using are you following me?
Yes.
Do you have anything else to add? Is there anything
Yes.
else that you'd like?
Perfect. Perfect.
I'd like to know? Okay.
Perfect. So ask about my understanding, start your station like that. And if I'm not very verbal, then you can ask me, do you have any 21? Do you have any idea why your child need vaccine? Okay, you told about the vaccine. What are vaccines? Fine. Why your child need vaccine? Then you will tell all these things, but you can ask question from your patient and then involve them. Okay?
Yes. Yes. Okay.
Address her concerns, try to know why she doesn't want it. She can be having any reason, like sometimes like I might say that my younger child, my elder child had the vaccine and then he felt really ill, or my child is having egg allergy, meat allergy, things like that. So she can be having any reason or she can be having no reason at all. Depending on that, you will address her concerns, but still you need to keep talking to her. And while you are doing that, you need to involve her and you need to give this information to her. So it's
Okay.
your IPS how you are going to involve. For me, I think it's always the best thing is always ask question, and if they are not if they are answering you, that's well and good. If not, then you can start your communication and then keep building it.
Okay.
Okay. So
Okay.
whenever we are making informed consent, we need to tell them why and for any procedure, not for the vaccine, we need to tell them why we are doing the procedure, or why we are giving you these jabs. Then what will it involve? It will involve how many vaccines, or what specific things they will be expecting, and what are the complications.
Okay.
All right. So
Yeah.
it was not a very difficult station, but this station can get a little bit tricky when your patient is not talking a lot. So, and you
Okay.
don't know what to talk about now.
Okay. Okay.
Okay.
Okay.
And any question? Anyone wants to add anything?
Well, sorry. I just want to say a big thank you to you guys for organizing this this discussion. I've learned a lot, and there's a lot of things I need to improve on, and I'll try and improve on them. Just to add, please, do you have any list of the new cases, like the newest ones? Yes, because I'm just seeing some new cases now. I don't know if you can just help us, if there's any way that you can help just type the newest cases that are coming these days. Thank you very much.